There you go. Okay, over to you, Dallas.
Okay, perfect. Can you all see that in full screen?
Yep.
Perfect. Hi, everyone. My name is Dallas. My pronouns are she and her, and I'm the founder and CEO of Reya Health. This is me. I was in third year university and the counting exam the next day, and I was admitted to the hospital because of adverse reactions to the birth control option I was using. This is actually the second time that I was admitted to the hospital. And prior to this, I have tried countless options of birth control methods, experiencing unwanted side effects the entire time, and also finding a lack of support, a lack of information, and really not feeling confident or comfortable along my sexual and reproductive health journey. And I'm not alone in this experience. Actually, 50% of Gen Z report going off of birth control, because of side effects. I also want to apologize for the sirens. I am in New York right now. I'm sorry if it's distracting. And yet, 50% of all pregnancies in Canada are unplanned. Nearly half of those unplanned pregnancies are a direct cause of people using a birth control option that just isn't the right fit for them. This has a direct cost to the Canadian government of $320 million annually. Today, we are seeing the highest rates of abortions and STIs, raising coverage costs, but also resulting in a sexual health crisis across Canada. Reya Health is revolutionizing our approach to reproductive and sexual health. Reya is a digital platform for personalized contraceptive counseling. We utilize smart algorithms and human-centered design to match people to the best birth control option for them, help them track and monitor any side effects or symptoms, all the while providing personalized insights, resources, and support so that they can feel confident and comfortable on their sexual and reproductive health journey. To date, we've launched various versions of an MVP. We worked with hundreds of beta users and actually achieved a 95% user satisfaction rate. So what this means is people were going through our process, acquiring knowledge and getting information, applying it to their life, and it turning out to be successful for them. We save folks a ton of time as compared to the traditional method of that trial and error process when trying to find a birth control option. We also are a preventative measure. So we reduce rates of abortions, STIs, and sexual and gender-based violence. Privacy is of utmost importance to us. So we're looking at and we comply with the privacy policies PIPEDA and FIPA here in Canada. And we've already looked at the HIPAA compliance in the US, but currently only operational in Canada. And doctors are loving us. Dr. Batley said that Reya is a much needed revolution in the patient experience. Dr. Alani says that she's thrilled Reya will be a go-to resource for people when figuring out which birth control option they should be using. There are a few other players in the space who are approaching the problem in a couple of different ways. For instance, Aiden and Tune are taking a more pharmacogenomic approach to contraceptive counseling with at-home DNA tests. This requires a lot of capital upfront for research and development. Aiden just launched their MVP at a $400 USD price point. We pride ourselves in the affordability aspect of our business. Of course, there are traditional health clinics, and that is the primary way of folks accessing contraceptives right now. But this is really perpetuating a lot of the problems in this trial and error process that we're seeing, and really why Reya Health exists to serve some of those gaps. Telehealth is a really great way to increase access to contraceptives and counseling overall. However, these clinics still take the traditional approach to contraceptive counseling, which is often seen as that one-size-fits-all approach. We're actually in discussion with various telehealth companies across Canada as potential partnerships and collaborators to integrate into their process as a platform license, which I will discuss a little bit more when we get into our business model. So Our main channel of revenue is B2B platform licensing to insurance, benefit providers, digital health clinics, and in-person health clinics. Right now, we're launching our platform as a pilot for $7,500 for a project term. We do have a downloadable version available for direct to consumer, and this is primarily for accessibility. We aren't investing any marketing dollars to promote this, but we really wanted to ensure that the people who needed these services the most had equal access to. We know that not everybody has access to an insurance plan. Or has access to a digital health clinic, and we really wanted to ensure that opportunity for everybody to access the platform. There are 1 billion people worldwide who use contraceptives. Our main focus right now is on post-secondary institutions through their insurance benefit plans. In Canada, there are about 23 schools that fit our initial target audience, with about $5 million as an obtainable market, and we see ourselves achieving that the next couple of years here. But Reya really goes beyond birth control. We're already talking to our users in our community and building out a product roadmap to support folks in other areas of sexual and reproductive health, such as STIs, pregnancy loss, and abortion support. To date, as I mentioned, we've launched different versions of an MVP, everything from a basic spreadsheet to a web-based version, working with a lot of users to validate and get a lot of feedback and iterating on our platform. We are now just about to launch a fully automated mobile app through these channel partners. We have had a number of customer discovery conversations with post-secondary institutions and found that they recognize that there's a problem and a gap within their services on campus when it comes to sexual and reproductive health. However, a number of them just don't have the budgets for and are actually looking to their insurance providers to step in and provide some of these supports for students. We have a partnership secured with Student VIP, which is a student health and dental plan provider for 34 different post-secondary institutions across Canada. We will be launching with them as a plan add-on in about 4 or 5 different schools that they have as part of our trial and pilot fee. We also have a partnership with Planned Parenthood in Toronto to really explore how Reya Health complements that in-person clinic visit. Moving forward, of course, we're launching the new product, which we're very excited about. That's upcoming this fall. Additional product features, as I mentioned, are in the product roadmap for the new year. We have plans to launch with 8 pilot licenses for this year, and $150,000 in revenue for the first year upon launch. We have projected revenue for about $450,000 in 2025 and $2 million in 2026. Within 2025, we have plans to expand into the US through channel partnerships that we're already establishing now. So actually today I'm meeting with Planned Parenthood Federation of America. I'm here in New York right now, and they're headquartered here, and they are actively looking for solutions to integrate into their process. As per the team, so it's myself largely doing a lot of the sales and partnership and business development, along with our advisor, Kirsten Kroos, who is very well connected in the health tech, life sciences, and government space when we're looking at integrating into other plans. On our team is a couple of medical professionals to create the methodology behind Reya Health. We collaborated with a team of OBGYNs, family physicians, and naturopaths. Dr. Tharavaeli is one of those that contributed to the IP at the onset. Lindsay Chastain, I will mention, is our marketing and growth advisor. She was the digital marketing director at Sephora and the growth and partnerships director at Ancestry. So she takes this knowledge of this younger demographic that we're targeting, as well as that health tech marketing experience. Reya Health will be the global epicenter for sexual and reproductive hormonal health data, information, and support, fueling innovation and women's safety worldwide. Please join us in reducing these unplanned pregnancies and STIs, partnering with grassroots and meaningful organizations to enrich that health data and the well-being of women overall. Thank you so much.
Awesome. Thanks, Dallas. All
No
right.
problem.
So let me see where we
I'm
are.
going to just stop sharing my screen for
Yeah.
now so I can actually see your faces,
That's
but I'm
great.
happy to reshare my screen if we want to talk to any slides in particular.
Okay, terrific. Nolan, do you want to kick off the feedback?
I'll go second. I like going second.
Second.
Yeah.
All right.
Or sorry, are Jen and Feiran providing feedback, or is it just me and David? Because
I'm going to ask the ones who aren't the coaches, so Jen can provide feedback to not her coach.
or I'll go last.
Okay, we'll have a total of three. David, we'll start with you. You're on
Oh,
mute,
David,
David.
Yeah, I'm gonna go second though. No, I'm just kidding. I'm gonna go first. Yes, thank you for that presentation. It was nice. I enjoyed it. A couple of questions. So one thing, whenever I see a TAM, everyone uses the same chart. It's the TAM and then the SAM and then the SOM. Those three dots. What as an investor, what I would prefer to see is, and maybe you're not along this far. They're not mutually exclusive, but I always prefer to see, we've won this contract with this company, and then show the logo and show a bunch of logos of people that you're doing business with, because no matter what you show in terms of a TAM or a SOM, it's the marketing up. Marketing up is really what will drive the company. And so showing logos is very powerful for an investor who says, wow, they've already got some customers and they're doing well that way. So that's just a thought. I have the same reaction every time I see that chart in presentations. How do you know, a question for you, I've been involved in a company that has a blood test for endometriosis. How do you know someone doesn't have that as opposed to a birth control issue? How do you find that out?
So through our questionnaire, we do one we flagged for. So our questionnaire covers all medical history, past experience with contraceptives, lifestyle, and preferences. So if somebody has been previously diagnosed with endometriosis, they would indicate that. But a lot of our other questions would filter out things because we all know that endometriosis on average takes about 10 years to be diagnosed with.
Yeah.
So there's a number of folks that are accessing or trying to access anyway contraceptives to help manage those symptoms. And within our other questions around menstrual cycle and their experience with their reproductive health, those things would come through. So we're asking about how heavy their period is, their cramping and their symptoms.
Okay, no, I get it. So I guess the important point would be, maybe it's important to have a slide that shows that you won't be dealing with other medical issues. You'll be dealing exactly with what your service does.
Are you sorry, just to clarify, are you speaking to the contraindications of
No, I'm more speaking to, you had a big chart with a lot of different issues, including endometriosis and others. And I'm not sure if I looked at that as an investor, I'm thinking, wow, they're going after a very large number of issues, when really you're going after a very specific issue. And I think it would just be more clear if it was, that slide could be a bit more clear. The other thing, I'll motor along here. One question that came to mind is you're dealing with telehealth organizations, correct? How do you feel you compete with a free telehealth, like we have Telehealth Ontario, and a woman can just call up and talk to somebody there? So you're really competing with a free a service, and some of these others are free. How do you compete with that and then put a paid model in front of them?
So we actually aren't prescribing contraceptives through our platform. So we aren't a telehealth provider. We are that patient support service. And really, we like to say we're, the patient's birth control best friend and then the clinician's counseling companion. And so when we're talking to doctors within our customer discovery that either do in-person clinics or telehealth care, they are really excited when patients come to them already having a few options in their mind that they're thinking about, maybe already having some questions. That makes the visit a lot more effective, a lot more efficient. It's not taking 30 minutes to go through all of these options. So the patients are coming already prepared. We also have tips and tricks for our users on how to have a more focused conversation and be that health advocate in those clinic visits, because they can oftentimes be intimidating, especially for the folks that we are working with primarily.
Okay,
And
no,
then
that's
physician,
good.
and then
I
we
got
have that
that.
follow-up support that also helps reduce the repeat visits in clinic. So giving that follow-up support through our platform that doctors just really don't have a lot of time to do.
Perfect. Okay, yeah, my last point is there's a lot of education, as you probably know, that has to go into something like this. A lot of education of not only end users, but distributors and everyone in between. So that's something to always keep in mind. You have to have a very strong, and I suggest you have it in your deck, a very strong slide that says, here's our education process. We have webinars and we have this and we're inviting our target market to these and we're getting good results. It's a big issue I've seen across multiple femtech type opportunities like this. But thank you again. It was really nice to see your presentation.
Thanks, David. I appreciate all of the feedback. And you're absolutely right. There's a massive public disconnect with this information, even within the healthcare space. So the education piece is paramount.
Yeah.
Thank you.
Feiran, do you want to jump in with a few comments?
Yeah, for sure. Thank you, Dallas. It just congrats on a lot of progress since our first call.
Thanks, Feiran.
Yeah, the space is what I always interested. I think for digital health companies that I've been working with, many of them trying to emphasize the workflow. So I think a little bit as what David has touched, like the whole flow of the work that you were able to provide, kind of trying to show like how you were differentiate with the others. I feel like that is actually something you're building very powerfully. You're trying to put the whole supply chain together. The other thing I would like to be more kind of deep dive into is the go-to-market strategy. Because I think on your roadmap, you were also showing some of the number. I wrote it down at the current, you have 300 users, over 300 users at the moment, and you're trying to grow to over 10K users moving forward in the next 12 months. What's actually the approach or channel you're trying to get to? I know you have a big already roadmap with all the academic institutions. Is that still kind of the main drive for you to go that way, or actually divide it between the clinics and the campus? And if you have added other channels, it just gives some confidence for us to see, this number is not coming from nowhere. This is actually, you have a good plan to figure out it's achievable in the next 6 to 12 months.
Thank you. I appreciate that. And yeah, we actually, through a lot of our conversations in running a sales process with the post-secondary institutions, quickly realized that it's more effective for us to go directly to the insurance providers themselves. We were often then passed from the schools to their insurance provider anyway. And having one partnership with the insurance provider, we can then filter through multiple different schools. So it opens us up to a much larger channel, and the exposure, even so far, even prior to launch, has been really, really great. We're already in the schools on the ground doing workshops and education and awareness with the students prior to launch even. And so it has a larger ripple effect now, us pivoting and focusing on the insurance plans directly.
Yeah, which makes sense, because I still remember like your first campus, I think was Carleton or Queen's University at the very beginning. And then we hit some rocks, like now it's actually all the shifting of the direction. It's just like a little bit more on the insurance sides, like the progress you have made, or whatever kind of number or data you can through, it will really show this channel actually is a much promising channel for us to achieve the goal what we want. And I don't know if you have any particular number that you have it, like solid number that you can give us as example, like for this insurance company that we are able to work with them for a particular campus that we're able to get to this number or something.
Feiran, can I just pause here because I don't want to run out of time. We only
no
have
problem.
for
Sorry.
Nolan.
Yeah.
So, but I think for Dallas, the point is here are the questions that people have in mind. You don't have to answer them obviously here. And if you've got that
Okay.
number, just think
Okay.
about that for your
Okay.
next iteration, right?
Yeah, no, this is really great. I'm already like envisioning a whole new, not a whole new one,
Okay.
all of how I'm gonna implement these. So thank you.
All right.
Perfect. Thanks, Dallas. So the big thing for me, like I'm all about the story. So I think you open obviously an extremely personal story, like a picture of you in a hospital bed, like that's, it made us feel something right away, which is great. But I think some of the challenge is like you don't actually connect it nearly as well to the product. Like you do the story links to the problem, and then the problem to the product, there's still kind of a gap between all of those. And it wasn't, to come to Feiran's point, like it wasn't completely clear to me who was actually going to be buying the product until you showed us the revenue model slide. Like all of those slides, you're not talking about insurance or clinics or whatever. You're talking about users being uneducated. And then it's like, here's the education platform. Here's some doctors telling us nicely about it, but now we're going to sell it to the clinics and the insurance providers. And I was like, whoa, like, why do they care? So I wasn't completely clear why they care. And then you hit us with the university angle. And then I'm saying, oh, yes, the universities care. So I think if there's a way, and you shouldn't lie, but you can kind of tweak your story to make it a little bit more connected. You're saying you were in university, you're missing your accounting exam. And guess who cares about women studying and tuition and not dropping out because they have a bad health outcome or an unexpected pregnancy or all of this stuff? So if you can tie a story around whether it's yours or a quasi made up one of this is a student, and sorry, made up one, I'm sure there's thousands of stories of university like female university students who have issues with birth control and can't finish their term or don't finish their degree, and who actually cares about that financially, the universities do. So that really ties it all through. You're hitting the problems, you're hitting the customer who's motivated. And so I think like there's just a better way to wrap all of that together to tie it in. And then it's like, and that's who we're targeting first. The 23 universities in Canada that fit, and the 10 times that many in the US that fit this option, right? And then we'll go to clinics. So this, like the market just layers and layers and layers. There's so much more opportunity of people who want to pay for this. And there's still kind of the impact story that you're hoping for. So that's
Thank you.
kind of
That's
like
really helpful.
the biggest piece that I think like it ties all of the angles, because even like your problem slide where there's all these impressive statistics, I've learned like 50% of births in Canada are unplanned. Like that's like to think of all the sexual education even that we get in schools and high schools, but now they're getting it on TikTok. So who the hell knows? And people still don't talk about stuff and all that. Like that was still surprising. There's a lot of surprising stuff, but sorry, I'm pausing. I'm kind of shifting to my next point. So my next point, it was not completely clear how your product actually helps. Like it would also be helpful to have a use case of like, I was on this pill and it was causing these issues. And then we recognized that this is the better course of care. And this would not have been done through a physician. This would not have been done this way. And they were able to do it in a week instead of 6 weeks or a month or waiting for get a family doctor because they don't have a family doctor, right? And just kind of making that story a little bit more real and that outcome more significant. And then tie it into, then that student could finish their term and get their degree and be a successful professional and not be derailed by something, whether it's the birth of a child, an abortion, or something like any of those kind of not great outcomes on that spectrum. But just seeing how the product kind of works would be helpful. So those are my two biggest points. Can I keep going, Jane, or do I?
You have 1 minute.
1 minute. I think on the competition side, it's really good, like double down on the affordability piece, right? Because realistically as well, this angle of being accessible, I presume people in the maybe lower income less educated bracket have more of these issues, right? And so they can't afford a $400, $500 test out of pocket. Other like small things on like slide design. The font on the roadmap slide was too small for like the subtext. The team slide needs a lot of work. I don't want to see who your interns are. Like focus on the key people, put some logos of where they've worked before. And maybe I missed it because I might have been taking notes, but this thing is at techpipers.com. I was confused as to what that was. And I think on your end, like you got to turn it up, like the excitement level, like 4 notches. Like I want to say you're bored, but you were like neutral level excitement about your company. Like you have to be the most enthused person. Like I know you might be tired. I know this might be your 12th pitch this week. Like there's all these kinds of reasons, I'm sure as a founder, that you're beyond exhausted and burnt out. But when you're pitched, like you just got to turn it up to 11 and be the most excited person about this company and passionate about it. Like you've got to bleed this, right? It's got to like come through the Zoom screen. And yes, it sucks to do it over Zoom and everyone's sick of Zoom and all this stuff. But like you got to just turn it up 3 or 4 more notches. That's it, Dane.
Thanks, Nolan. Okay, great. I'm just going to stop the
Thank
recording.
you all. I really appreciate it.